That's it for traffic.
Well, it's 7:50 in the morning, and look who we have here. Dr. Williams, who is a regular, Dr. Jerome Williams, along with Dr. Tomeshia Hubbard this morning, and we're talking about irritation to the skin this morning, right?
Yes, well, we're actually going to talk a little bit about vaccine reactions and how the vaccinations that your pets get can sometimes affect their skin and how it actually affects their skin.
Now, so often, Dr. Williams, we talk about humans who have reactions to medicines and such, but now we're talking about animals. How often does this happen?
Not too very often, but it does, and when it does, it can be life-threatening. When it's not affecting the system systemically, it can cause the kind of skin lesions Dr. Hubbard's going to talk to us about.
Now, when do you refer someone to Dr. Hubbard? What kinds of things do you see in a dog that you'll say, I think you need to see Dr. Hubbard?
The most common things that I'd refer on is when I get a lesion, a skin spot that this doesn't heal, it doesn't look right, is not responding to my normal, usual therapeutic treatments. And then I need some expert advice that I can get from a dermatologist like Dr. Hubbard.
So, Dr. Hubbard, are there some vaccines that are predisposed to cause trouble more than others?
Well, not necessarily. Any pet can have a reaction to a vaccine. It could be a different company, type of vaccine, or it could be just the way the pet system
Nino wants to get to Jillian this morning.
Vaccine. Exactly.
There you go.
Exactly.
Don't let us interrupt you guys. You know.
No. But you know, sometimes what you'll see is that they may get facial swelling. Sometimes they'll get wheals that pop up on their skin, and a lot of times we have to treat them with like Benadryl or steroids in order to get those reactions to resolve.
Okay, I think we have some pictures, so maybe you can comment over some of these. Okay.
Exactly. Yeah, that's a puppy that's had vaccinations and the facial swelling. You can see the edema in the face, around the mouth and around the eyes.
His eyes are swollen shut.
Exactly. If you notice that after vaccinations have been given, you definitely need to contact your general practice veterinarian immediately to let them know that that type of reaction has occurred.
Yeah, that's fairly obvious. That
exactly.
Something is not right. Okay,
Yes.
now what is this one?
Now this is a vaccine site vasculitis. So sometimes with a rabies vaccine, you'll see that there may be some hair loss in the area where the vaccine was given. And so those particular patients, we have to put on special medications to help the blood supply to those areas.
So are these vaccines harmful in this way?
Usually they're not really severely harmful, but you know, it's definitely something that needs to be addressed.
Oh, look at this one.
Yeah, this one has a vaccine reaction as well, and you can see the wheals that have popped up all over the skin, kind of lumpy, bumpy skin. But usually if we put them on Benadryl or steroids, those lesions usually go away. Probably within an hour to 2 hours, you'll see that those lesions all disappear.
Is there any discomfort associated with those kind of like little bumps all over it?
Sometimes they can be a little itchy. They may rub their faces or they may rub their bodies on the floor or the carpet just to kind of get a little relief from the itching.
Are there any more pictures? Those are really interesting.
Those were, I think, all the ones we had this morning.
So,
but yeah.
One of the things I'd caution our viewers, if your pet has shown any kind of reaction, is allergy prone, you might not want to get those vaccinations late in the day. You don't want to get them close to closing time, so there's nobody around to respond if there's a reaction.
Okay, that very interesting segment, because we didn't know that some dogs have reactions to different vaccines. Dr. Jerome, always, thank you so much. And Dr. Hubbard, again, thank you. And Nino and Jillian, now you're calm.
Yes, so we're trying.
Thank you guys for joining us this morning. Let's go to JJ.
All right, Sarah, thanks very much.